Good afternoon and welcome to this month's member webinar hosted by Wisconsin Cheesemakers Association in partnership with the Dairy Food Safety Alliance. I'm Grace Atherton, WCMA's Communications Director, and I'm so glad to have you with us today as we focus on food safety. We'll dive into the latest resources available to you from WCMA and the Center for Dairy Research first, and then we'll take a closer look at whole genome sequencing and how it fits into the landscape of foodborne illness detection and prevention. First, a couple of housekeeping notes before we get started. Please make sure your mic is muted and your video is turned off to avoid interruptions during our webinar. You can submit questions anytime in the chat during our session, and we'll do our best to address all of those during our Q&A at the end. And finally, a recording of this webinar along with a list of resources and contact information for our presenters will be shared later this week, so watch for that in your email inbox from me. First, before we get going, I'd like to thank our sponsors for today's webinar. Thank you so much to Nelson Jameson and Saldesia for sponsoring this session today. Now let's take a look at our agenda. First, we will look at the Alliance approach, how we strengthen food safety through industry connection. That'll be hosted by WCMA's Kirsten Strominger. Then we'll hear from Alex O'Brien of the Center for Dairy Research on how the tools and resources they offer for dairy processors and manufacturers to maintain food safety are set up to help you reach success. Then we'll hear from Craig Hedberg of the University of Minnesota on whole genome sequencing and its role in foodborne illness outbreaks and other applications. Then we'll move to Q&A with our presenters before we wrap up at 2 o'clock. So with that, I will turn things over to WCMA's Kirsten Strominger for a primer on the Dairy Food Safety Alliance. Kirsten?
Hello, everybody. Thanks for being here today. I am Kirsten Strominger, and I represent WCMA as part of the Dairy Food Safety Alliance. This is a partnership between WCMA and the Center for Dairy Research. We formed this group to connect dairy food safety professionals to gather together, to network, and to learn about the latest in food safety news, hot topics, and resources. So we've been meeting biennially, offering hybrid meetings and some facility tours. Some of our recent meetings have featured speakers from the Wisconsin Department of Agriculture, Trade and Consumer Protection, and Dairy Innovation Center. We've had presentations on various topics such as PFAS, temperature controls, sanitation, and also insights and advice from dairy plant inspectors. The Dairy Food Safety Alliance is open to all dairy manufacturers, processors, and suppliers, regardless of WCMA membership. Our goal is to make these food safety resources accessible and these connections accessible to all in the dairy industry. So on our WCMA website, we do have a page of templates and resources for food safety plans. These have been put together by Larry Bell and Jim Miller and Alex O'Brien. So we offer these FSMA compliant templates for dairy processors covering SOPs, records, and some support documents. These templates are a resource that can provide guidance as a self-assessment and can also be shared with the supply chain to enhance and or develop FSMA compliant documents. So these templates provide a good foundation for an effective food safety system. And we do update these regularly. So these guys are annually, constantly updating these to make sure that they are current. So everything on the website as of this moment is current, and we do update them. But for more resources, I'm going to turn it over to Alex O'Brien from the Center for Dairy Research to hear more about resources and things that can help you in your business.
All right, thanks, Kirsten. We're going to keep this relatively quick. I'm just going to make sure I can share here. All right. If you could let me take over now, that would be fantastic. Thank you. All right. Alrighty here. Here we go. So there's a lot of different resources that many people just don't know about. Some of you guys who are seasoned might already know about this and say, Alex, I've been on the FDA website. I know about Dairy Management Inc. I know all sorts of things that CDR already does. Well, that's cool, but we're just going to do a brief overview of those resources. All right. Number one, CDR, we are a resource for you. We have over 50 people on staff. Um, and we've got analytical labs. So if there's different, analytical tests that you might need, or even we're getting into whole genome sequencing capabilities. No, not necessarily. We're trying to focus more on the quality side, so not as much the food safety for whole genome sequencing, but that's still an option for you. There's the dairy product and processing technology group, the cheese group. We have 4 mentors that go around in the Midwest region, and then you have myself. So I like to say we have resources everywhere. So if you guys haven't heard of Safe Cheesemaking Hub, um, go check that out. It's actually in the middle, we're in the middle of reformatting it, but it's tied to the American Cheese Society, which has a library there. You can have COM-based access there, open access to some journals. There's some online courses and also some webinars as well. And then I think a really good partner for the dairy industry is Dairy Management Inc. for sure. Um, at their website, if you type in Dairy Management Inc., focus on food safety, uh, there's going to be training that's available, guidance documents, which I partner with several other industry and academia to create those guidance documents. There's also webinars. There's a really good one on forum material that's readily available to you. And that's about, I think about 40 minutes to an hour long. But there's all sorts of free tools. There's the controlling pathogens in dairy processing environments document. Um, excellent document to check that out. There's also dairy equipment design checklists. We go over this checklist in the advanced sanitation course. How do you evaluate sanitary design as well as dairy facility design? So those are free. If you just go on to the focus on food safety at Dairy Management Inc. site, and it should be the link above there as well. There's webinars, and then also there's workshops. So check that out. There's also an interactive map of all 50 states of food safety resources that you can reach out to. Um, we have quite a few resources here in Wisconsin. We've got Food Research Institute. We've got CDR here. But all across the United States, say you have a supplier that needs they need some food safety help, and they're not in the Midwest region, or maybe it's somewhere else. You can share this information of this map, click on any one of those states, and get a contact. This was a guidance document that was helped put together through DMI and the Supplier Controls Food Safety Resource Packet. Check that out. That's an excellent resource. And then a new one. It's the Food Safety Training Packet. We actually worked together with individuals from industry, academia, myself, and DMI. And we went through and we thought, okay, what are some free resources for food safety training? Because all of us have to do it. Um, it's mainly geared toward artisan, but there might be toolbox talk here and there that might be useful for any size corporation. All right, won't go over this because Kirsten already talked about it, but we are doing a third revision for that very soon. So that keep your eyes open for that. There's the thermization calculator. Some of you guys utilize raw milk to make cheese, which is fine. This thermization calculator was put together by the Food Research Institute to calculate the amount of listeria as well as E. coli 157H7 log reductions based on the time and temperature. And they just updated it to include the avian influenza log reductions from the Cornell study that has been very influential. So please check that out. Utilize that for your food safety plans. Don't forget about the dairy pipeline. This is a free publication that you can subscribe to from CDR. There's several different things that, range from quality to food safety. And we've written a few um, articles in the pipeline about wood boards, outbreaks, some of the recall, just analyzing what the breakdown of, what percentage was microbiological versus foreign material chemical, as well as allergen and foreign material control. So definitely check that out. We also have just a dairy recall tracker. If you guys are subscribed to the FDA notifications, hey, this is just a place where we've consolidated many different recalls. And at the bottom, we also consolidate a lot of warning letters that I think are pretty applicable if you want to talk to your management team. Hey, this is something that came up. Looks like they're really focusing on making sure your hazard analysis has sanitation preventive controls. And that's all in on this website. We also have a YouTube channel. We've got over 130 subscribers now. But basically, these are just toolbox talks. A lot of questions that we get from you guys and in a more digestible medium where, some people don't like to read. We do a lot of publications. We do a lot of research that we publish, but also this is just an easier form to communicate maybe to people on the plant floor, or you just want a quick answer that, like, can someone just explain it to me in 5 minutes? And if you go to our safety and quality page, there's a lot of articles that you can access there. Instead of like searching for it, there's just like a repository of things that would be good for food safety. There's some free posters, 1-point lessons, other links to videos, and not to mention, we offer our short courses. So we currently give HACCP, and that's going to be in the May timeframe. Now PCQI, which eventually I believe we'll be combining those because there'll be one certification, hopefully, if they approve it through the International HACCP Alliance. So stay tuned for that. That might be just one course that would satisfy the International HACCP Alliance standards. The Advanced Sanitation course, that's coming up in October, and then right piggybacking off of it, since it's hard to split environmental monitoring from advanced sanitation, but many of you guys don't like to send your employees out for 3 days straight. It's hard to be without someone for 3 days. So advanced sanitation is 2 days, and environmental monitoring is one. So here's just some examples of 1-point lessons that we have on our website. And then don't forget about Google Scholar. Sometimes you might not have access to any of these journals, okay? But if you find something on there and then you can't access it, you can just ask me, say, hey, I was looking for research on thermal death values for our processed cheese or something, and I found it, but I can't access it. I have the access to most of these things. And also, if you're like, hey, I don't know, that's scary. I do this a lot. People ask, like, do you have any research on X topic? And I'll search for it, and then there won't be any papers or there'll be quite a few, right? So it really depends on the topic, but that is definitely a resource. Don't forget about it. And there's, industry guidances out there. You're probably familiar with most of this list, but I want to highlight that they made a second edition of the Environmental Monitoring Handbook. And you can access this on our food safety page. And if you have any questions, I'm a resource to you. That's 608-598-9997. Sorry, 9977. That's my phone. You can email me anytime, and I will help you as best as I can. All right. And then really for the main event here. So environmental monitoring and outbreaks, right? So a lot of times in our plant, we are checking for pathogens, and some of us are scared to use that whole genome sequencing. And I'm not saying, hey, you should do that, right? But I wanted to give everyone kind of an idea of how FDA uses their information on their side to track outbreaks, to give you more informed decisions on how you should do environmental monitoring. All right. With that, I'll let Craig take it away.
Great. Well, thank you very much, Alex, and I really appreciate the opportunity to have some time speaking here today. Let me just get this going here. Let me see here. Hang on one second here. Okay, can everybody see that? Am I still with you?
Yep, you're still
Yep,
with us.
looks great.
Okay, good. Good. Well, I appreciate the opportunity to speak with you today. What I want to talk about is whole genome sequencing and how it's used in outbreaks, and increasingly how our regulatory agencies are using it to help identify outbreaks that have previously been unrecognized based on our traditional surveillance for foodborne diseases. And my objectives today really are to help you understand that the whole genome sequencing is a powerful tool for linking human illnesses together and with food and environmental isolates. I want you to understand that routine sampling of food or environments by regulatory agencies may provide a key link to otherwise unexplained illnesses, and to understand the importance of eliminating persistence of potential foodborne pathogens from production environments. Outbreak detection historically has been something done by public health agencies following up on individual cases who've been diagnosed with illness. Increasingly, outbreak detection isn't linked to small clusters of people by space and time. Whole genome sequencing really expands the horizon of how cases can be associated with an outbreak. And it's important, I think, for you to have some understanding of how that is being used today. But I do want to start with sort of an overall picture of how we do public health surveillance. I'm an epidemiologist by training. I spent many years investigating outbreaks. Now at the University of Minnesota, work with our public health agencies and the regulatory agencies who are involved in these investigations, and really are trying to improve our outbreak investigation processes. And this cycle of public health prevention is tremendously important for maintaining the integrity of our food safety system. We have our public health surveillance, the ongoing systematic collection, analysis, and interpretation of health data. In this case, we're talking about cases of illnesses, Salmonella, Listeria, E. coli, that get diagnosed and reported. When there are outbreaks potentially identified, that leads to investigations, which in many cases may identify a cause that can then be translated into prevention measures. But sometimes these outbreak investigations identify new hazards, things that we hadn't previously recognized. And it's important to keep in mind that we realize the complexity of producing food and the changing environments in which this happens. And we have to anticipate that there are going to be new things emerging. And our outbreaks are one of the tools we have for identifying those, which then can be used to develop better prevention measures. And ultimately, it provides feedback on the effectiveness of our food safety systems. So if things go wrong, we can make corrections and hopefully stop those from happening again. So in our national system for foodborne disease surveillance, we have the individual states that do most of the primary following up with cases and identifying outbreaks that occur within our states. And then CDC on a national level coordinates our surveillance activities and compiles data to provide an overview of what's happening across the country. This slide shows some data from a 2023 food safety report based on CDC surveillance data conducted through FoodNet, an active surveillance network. And what you can see here is not terribly encouraging. For several of our pathogens, we've been seeing increasing cases occurring. A couple important ones, Listeria and Salmonella, no change, but really no progress towards meeting our public health goals of reducing the incidence of disease. And reports like this are important partly because the federal agencies, FDA and USDA, look at this, and that stimulates them to try to increase their efforts to try to work with industry to prevent these diseases occurring. But when we look at data like this, the lack of progress does not necessarily mean that food is getting less safe. And there are things changing within our surveillance system itself that can increase the likelihood that diseases get reported. And so we want to look at some of the improved investigational approaches and tools that have been developed in recent years that have affected how we identify outbreaks and investigate them. So on the laboratory side, one of the really big changes that has increased reporting of foodborne diseases has been the development of culture-independent diagnostic testing. Many of these are multi-disease panels that can be conducted at a clinical laboratory or a hospital laboratory. And these provide a single test that might be able to identify 20 different potential foodborne pathogens. And the results are available in a matter of hours rather than the typical culture results that may take several days to be developed. What this has done has been to create stimulus to clinicians to test more often, because now they can get data in real time that can help them decide what to do in managing an individual patient with a diarrheal illness. And so we think that there are more people being tested with diarrheal illnesses to see if they might have something like Listeria or Salmonella or E. coli than in the past. And that is, from a public health standpoint, potentially a good thing, except that these CIDT diagnoses are PCR-based tests, and they don't generate an isolate. And we need those isolates, the Salmonella bacteria, getting into public health laboratories, because whole genome sequencing is a subtyping method that allows us to identify which cases of Salmonella or which cases of E. coli might be related to each other. And so the development of CIDTs has shifted a burden of culturing clinical samples into the hands of the public health laboratories. Now, that doesn't necessarily become a problem, except for the fact that we're also facing some reductions in funding for public health laboratories. So we're at a unique point in time when we have unprecedented tools to use and challenges to our ability to use these tools. Similarly, with epidemiology, we've developed processes for having standardized routine hypothesis generating interviews so that as clusters are identified, we can begin to collect data that allows us to compare exposure histories across cases, and then allow that to be a basis for comparing what might be common between these cases that could be a possible source of exposure, and then rapid informational tracebacks with the regulatory agencies to identify if somebody said they ate a cheese product, where did that cheese product actually come from? Coupled with environmental assessments, all of which are designed to give us a better picture of what was likely happening to lead to the occurrence of the outbreak. So whole genome sequencing has really become an engine that has really changed the effectiveness of our public health surveillance and outbreak investigation processes. And of course, whole genome sequencing involves starting with a bacterial culture, and then the DNA from that culture is extracted and chopped up, and then sequencing occurs, which then gives us a very granular picture of what is happening with that isolate, and allows us to do some very fine comparisons between multiple cases to see how closely related organisms might be, with the idea that if two organisms are very closely related, they may well share a common source. So that has allowed more outbreaks to be solved using fewer cases per outbreak to be able to do that. And this is an example of how that has actually worked using data from Listeria. So Listeria is one of our more important foodborne pathogens that is tracked on a national basis, partly because of the high rate of hospitalization and death among cases that get recognized. But it's a relatively uncommon organism overall. In the United States, we have on the order of 1,000 cases or fewer that are diagnosed each year in the United States. And this timeline goes from 1983 up through 2023. And it really highlights how our public health system has changed and how that changing public health system has helped us prevent Listeria from occurring. So prior to 1998, we really didn't have any good subtyping systems for Listeria cases. And this is what we call the pre-PulseNet period. And what you can see there is that there were very few outbreaks of Listeria ever diagnosed or recognized. On average, it was fewer than one outbreak per year occurred. But when the outbreaks occurred, they were very large. And it was the very big size of the outbreak that led to their detection. PulseNet was a system of subtyping based on pulse field gel electrophoresis, a relatively crude but effective measure in which again, you start with an isolate, you chop it up, and then you look at sort of how the chunks of DNA by size aligned, and it created a fingerprint which gave us some better sense for cases that might be related to each other. And you can see that as PulseNet was introduced for the surveillance of Listeria, we began to see a steady increase in the number of isolates of Listeria that occurred for 2 outbreaks per year, and the size of the outbreaks shrunk quite a bit. So the ability to link these cases together, allowed us to investigate things more rapidly and kept outbreaks at a smaller size. And you can see that red line going down. This is the actual incidence of Listeria per million population. So as we started to see more outbreaks being detected, that led to investigations, which then gave us information about where the risk for Listeria was occurring. And that helped the regulatory agencies work with industry to try to identify and change those practices and reduce the risk of Listeria. Around the early 2000s, then CDC initiated what they called the Listeria Initiative. And this was an attempt to get isolates from every case that was diagnosed in the United States and to make sure that every case was interviewed. with a standardized exposure questionnaire. And you can see again that that led to more outbreaks being detected and a further reduction in the size of the outbreaks. Then around 2013, we saw the introduction of whole genome sequencing and the use of whole genome sequencing for listeria surveillance. And again, we doubled the rate at which outbreaks were being detected, and the size of the outbreak stayed about the same. And we've had sort of a steady or fluctuating incidence of listeria occurring with that. But when we look at sort of the changes that are going on in the world with respect to the aging population, having a relatively steady incidence of listeria actually suggests that we're having better control of listeria, going on in our food system. This is just a comparison of listeria rates in the United States in red with England, Wales, the European Union, and Canada. So we have really maintained historically low levels of listeria in the United States over time, partly because of the effectiveness of our foodborne disease surveillance system. So outbreaks are also important because they identify some of the common causes of foodborne illness. And CDC, FDA, and the USDA work together to look at what are the causes of outbreaks associated with our various foodborne pathogens. And you can see this data from 2022 for listeria, in which the 37% of listeria outbreaks were attributed to dairy products, making listeria the leading cause of recognized cause of listeria, dairy products, leading cause of listeria. And again, what this does is provides evidence to FDA that that they have to be paying more attention to dairy products so that they can try to do a better job of identifying the source of those products leading to human illness, and that stimulates more testing by FDA and some of the state regulatory agencies, to try to reduce the burden of illness associated with those dairy products. So our outbreak surveillance is helping to guide regulatory behavior as well. And listeria is a very interesting pathogen for a number of reasons. But one of the things about listeria is that the risk of disease varies both by the level of contamination and by the susceptibility of individuals. So, as I said, we only have about 1,000 cases of listeria diagnosed every year in the United States. Listeria is a relatively common organism that people might encounter at low levels from a variety of fresh and processed foods or other environments. And this slide shows some dose response functions for listeria. On the bottom of the scale here, we have log doses. And this is a log dose of 2 means that you've got 100 organisms, say, per gram of product. And as that level of contamination increases, we see the risk of illness on this slide also increasing. And these various lines that we see here represent different fractions of the population by risk. So the red line on this top side here represents women over the age of 75 who are exposed to listeria. And you can see they are a high risk category for listeria. And so at any particular dose of exposure, they're more likely to develop illness than, say, a younger person or a woman, at a younger age who's otherwise healthy. And so this risk data is really used as we can begin to process, what level of exposure do we need to really try to work at. On this slide here, we've got two lines. This vertical line is at a level of 100 organisms per gram. And you can see that at that level, we have a relatively low likelihood of anybody becoming ill. But we can see again that that there are some categories of patients who have higher risk. So people with hematological cancers, leukemia, solid organ transplant, where as part of the transplant process, they're actively suppressing the immune system. People with renal or liver failure and pregnancy are associated with higher risks of illness than we would see within the general population. So in this example, going from, say, 100 organisms per gram to, say, 1,000 organisms per gram, which would be around here, would increase the risk of illness also by about 1 order of magnitude, from 1 in 100 million servings to 1 in 10 million servings. So these look like really low risks of illness, but we have a lot of food items that are produced at very high levels of production. And so even a relatively low individual risk, when you look at a very broad distribution pattern, can result in a large outbreak. And an example of that is the listeria and bluebell ice cream event that happened in the early from 2010 to 2015. It was an outbreak that was recognized sort of toward the end of that time period. And over this period of about 5 years, there were 10 cases of listeria that were recognized as being linked together. And they were recognized because of the availability of whole genome sequencing to group the cases together. There were 5 cases that occurred in Kansas that were all associated with a single hospital that had product that they were serving, ice cream that had been made in a Texas facility. And then there were assorted cases in Texas and elsewhere that were associated with an Oklahoma facility that produced separate ice cream products. But it was whole genome sequencing that allowed these cases over a period of 5 years to be linked together. And as part of this investigation, as it was carried out in 2015, FDA did some extensive sampling of ice cream coming out of one of these facilities, one particular production line that was associated with the cluster of 5 cases up in Kansas. And they tested over 2,000 samples of ice cream produced over a period from November 2014 to 2015. And what they found was that almost all of these samples contained listeria. There was almost all of the listeria, the ice cream samples had listeria, but they had listeria present at very low levels. There were only 98% of the samples had fewer than 100 organisms per gram of product present. So so there was almost uniform contamination of the ice cream with very low levels. and that produced an outbreak that had 4 cases associated with listeria in this hospital, including 2 deaths among people who were highly susceptible population of elderly persons, and they had been hospitalized for other medical conditions, and their exposure happened in the hospital as a result of exposure to milkshakes that were made with these ice cream products. And so this outbreak has been interpreted by different people in different ways. One, because the vast majority of these samples were positive at a very low level. It has been interpreted to mean that there is no safe level of listeria that can be tolerated in ice cream. Other people look at this and say, we had almost all of the ice cream coming out of that facility contaminated with low levels of listeria, and yet the only cases we saw were in a subset of a population at very high risk who were eating the ice cream not in its original production form, but as in the form of a milkshake, which introduces the possibility for other amplification to occur. But in either case, what we have is an outbreak which demonstrates the utility of our whole genome sequencing. This is a slide taken that shows relationships between the 2 facilities and a variety of cases and food and environmental isolates that were determined from sampling of products. And the distance between these clusters, basically is a measure of how many differences there would be between isolates within these. And because both of these facilities probably had some persisting environmental contamination, there's some evolution of the organism while it's in the environment that goes on that can be seen by how tightly or loosely clustered the individual cases are. And this is one of the things that is also available with data coming out of the whole genome sequencing. We can show links between them, and we can also learn something about the evolution of the organisms in place. So this is a listing of some multi-state foodborne outbreak notices in recent time coming out of CDC. And as I said, CDC monitors PulseNet. They get reporting from all the states. They identify multi-state clusters of cases and initiate outbreaks. And some of these they highlight on the CDC website, and this just gives you a flavor for the range of different pathogens and food items that are associated with these items. And in 2024, there were 2 outbreaks associated with cheese products, an E. coli 0157 outbreak associated with raw cheddar cheese, and a listeria outbreak that had been recognized with queso fresco and cotija cheeses. We'll talk about these outbreaks a little bit. The E. coli outbreak details are summarized in this slide. So that was recognized in the first cases were recognized in October of 2023. Cases occurred from October of 23 through January of 24. 11 cases altogether shown in this map, most of them in California, Colorado, Utah, and Texas. There were no deaths, but 5 hospitalizations. E. coli 0157 cases tend to get a lot of attention from public health agencies because of the risk for hemolytic uremic syndrome, a life-threatening complication that affects children and as well as elderly people. 10 of the 11 cases were interviewed. 7 of these reported specifically eating raw farm brand raw cheddar cheese. Now, there was some testing of cheese products done in the context of this outbreak investigation, and they all were negative for E. coli. But CDC warned against all raw cheese products from this firm and requested, sort of advised the public not to eat those products. And I would like to just say that the fact that the product samples that were tested were negative for E. coli doesn't really rule out those products as a source of illness. In many cases, the level of contamination of the product may be very low. It may be below the level of detection that most of our sampling can pick up, or the sporadic contamination, the samples that were consumed that caused illness may not have been, representative of all the product coming out of that plant. But this association of 70% of the cases having an exposure to this product really is strong evidence that the product was associated with those illnesses. Also, around this time frame, there was a larger outbreak of Salmonella typhimurium infections that was associated with raw milk consumption in California and 4 other states. This is a headline from the CDC's Morbidity and Mortality Weekly Report, where they will typically highlight important outbreaks that may have prevention messages that CDC wants to communicate to the public health and the public and the industry. This is a slide showing the epidemiologic curve. This was a much bigger outbreak. You can see a depiction of the onset of over 170 cases of illness in the time frame over which these cases were identified. Most of these people drank raw milk, and there were positive samples of raw milk from the dairy farm that were positive. There were a number of people who also or only ate raw milk cheeses that were produced by this facility. And one of the things that is important to think about is when we use these tools, whole genome sequencing, we're using them to link cases together. And this is in the box here. I have a outbreak the sort of the case definition that was used. A confirmed outbreak strain highly related within 2 alleles using core genome multi-locus sequence testing, or a single nucleotide polymorphism branch 0 to 6 SNPs. So, those are measures for how closely related these organisms are. And those are pretty closely related organisms in that sense. And as a public health response to this outbreak investigation, CDC basically advised people not to drink milk from this farm. The farm halted production and voluntarily recalled its milk. And they took some of the recalled fluid milk and heavy cream, and recalled lots were destroyed, or some of it was used for producing some cheese, aged cheese production, with the cheese to be held under impound by the California Food and Drug Administration. And raw cheese made from the contaminated milk lots tested positive after 60 days of aging, and that cheese was not subsequently distributed for retail sale. So I want to look a little bit more about this issue of how we detect clusters. And this figure I have here is from CDC. These are some of the criteria that are used by CDC for PulseNet data in determining if there's a multi-state outbreak potentially going on. And one of the things that we can see here is that I've highlighted the case threshold value. And we can see that for Salmonella, CDC has a higher threshold for calling something an outbreak than they do for some of the other pathogens. And we can see Listeria, 3 or more clinical cases that have matching patterns would be considered a potential multi-state outbreak. And so these things vary by agent depending on the level of importance to investigate the potential outbreak. And also sort of the stringency of the cluster definition and the timing of the cases in the cluster also varies by agent. So for Salmonella, typically you're looking at more cases. The cluster criteria would be cases matching within 10 alleles, with at least 3 cases within 5 alleles, and at least 3 from a single state. When we go looking at across all these different criteria, Salmonella are a little bit, more stringent to identifying a case than some of the other ones. With E. coli, if they have within 10 alleles and at least 3 cases within 5 alleles, would stimulate a multi-state outbreak investigation. And for Listeria, within 7 alleles by CLG, core genome MLST, further refined by whole genome. And what we can see with Listeria then, that they would include historical isolates within 25 alleles. So there's a lot of variability from pathogen to pathogen based on historical knowledge and how important the agencies feel that identifying the source of these outbreaks would be. And all this whole genome sequencing data gets put into publicly accessible databases where public health agencies find clinical links, they identify clusters, and they use this to begin traceback efforts. And increasingly, what FDA is doing is, as they do their testing, and they're adding data on their test results into this system, if they find that they've got, environmental swabs, say from a plant, and they see that there are clinical cases that might be related to those swabs, that will launch an investigation on their part. So this is a figure showing a tree that is generated from the genome tracker database, showing a clinical case from 2018 that was linked reasonably closely on a tree with 2 environmental swabs that FDA had identified out of Florida from earlier and a little bit later from that first clinical case. So that leads then to an investigation. They try to look for what are the sources of exposure that the case had. And if they can identify that the cases that were close in this cluster had exposure to products that came out of those facilities, then that will really lead to an outbreak investigation. And this is a little bit of what happened with the Cotija cheese outbreak that was recognized in February of 24. This involved 26 cases, 23 hospitalizations, again, because most of the people who get identified with Listeria are people who have been hospitalized because of the severity of the illness. 2 deaths, and cases were distributed across 11 states. And the little insert on the bottom is an epidemic curve showing when people got sick. So you can see that these cases are occurring from a period going back from 2015 through 2024. So we've got a fairly long time period over which illnesses from the same source actually had been occurring. Now, CDC had investigated this outbreak 2 different times in 2017 and in 2021. They had following up on clusters of cases. They had epidemiologic evidence that identified queso fresco and other similar cheeses as potential source of the outbreak, but they didn't have enough information to identify a specific brand of product. So they had suspicions, they couldn't identify the actual source. But the fact that the isolates were all closely related to each other suggested that people in the outbreak got sick from the same food. So then what happens in January of 2024, the Hawaii State Department of Health, Food and Drug Branch collected a sample of aged cotija cheese product made by this facility during routine sampling. So they just pick up a product sample out of a retail establishment, and that is found to be positive, and it is found to have matches the outbreak strain associated with the illnesses that had been occurring. So then that led FDA to conduct inspections at the facility, collect additional food and environmental samples. And FDA found the outbreak strain from 2 environmental samples that were collected at the facility. So following the initial identification of the positive sample, the company issued a recall, and they noted at that time that to date no confirmed illnesses have been related to this product being reported. And the recall was a result of the routine sampling program. However, as a result of the routine sampling program identification and the fact that the bug actually matched the strains from the outbreak, the state and local public health officials went back and re-interviewed people over this long time frame to ask about foods they ate in the month before they got sick. And of 22 people who were interviewed, 73% reported eating queso fresco, cotija, or similar cheeses. And among people who remembered specific brands, 4 reported eating brands made by Rio Lopez. So based on that evidence, then there was a much expanded recall announced in February of 24, with the reason for the announcement being foodborne illness. So at the time the original product sample was found positive, the illnesses hadn't been linked, but very rapidly those illnesses could be linked because the cases could be recontacted, re-interviewed, and the fact that the matching isolates provided a framework for the re-interviews led to this outbreak occurring. And this really is, a great example of why, if environmental contamination persists, it becomes increasingly likely that it may eventually be linked with human illnesses. And it really emphasizes the importance of environmental monitoring and eliminating of persisting strains, which is essential to prevent illness. So I'll just close with this reiteration of our objectives here. Whole genome sequencing is a powerful tool for linking human illnesses together and with food or environmental isolates. And we have our regulatory agencies increasingly out there testing products because they have them on a list of potentially important sources of illness. And as they find more pathogens in food or environmental specimens, they're going to do more work to try to link those to illnesses that might otherwise not have been associated with an outbreak. And this really provides a strong incentive for all food producers to really up their game in eliminating persistence of potential foodborne pathogens from production environments. So with that, I will really stop sharing and close this discussion.
So data information there, and really does make a strong case for environmental monitoring and staying on top of your food safety practices in your plan. Unfortunately, we don't have time today to go through all of our pre-submitted questions. We did have a couple, so we will send those answers from Craig from our speakers in writing with our follow-up email to registrants, so watch for those. You'll also receive a link to a recording of this webinar, as well as contact information for our presenters and some helpful resources that were mentioned throughout our presentations today. I want to give one last thank you to our sponsors for today's webinar, Nelson Jameson and Saldesia. Thank you so much for your generous support. And I want to put in one final plug as well before we close for WCMA's next free webinar. Discover the power of WCMA membership. We're going to be taking a deep dive into all the different things that your WCMA membership offers you, things that you may have used before and things you may not have even known existed. So this will be for current members and anyone who is thinking about joining but hasn't yet as well. So mark your calendar now for Thursday, September 11th at 1 p.m. And registration for that is open right now at wischeesemakers.org/events. Thank you so much again for your time. Thanks to our presenters for their time and expertise as well. We'll see you on our next webinar. Have a great afternoon.